Hey everyone, and welcome back for another deep dive.
It's great to be back.
Today we're going to be tackling something that I think is really important, especially as we get older, or, if we're helping to take care of someone who is...
Absolutely.
We're talking about medications and specifically, how managing all the different prescriptions and over-the-counter stuff can get really tricky.
Yeah, and especially when you're dealing with, chronic pain, right?
Exactly, chronic pain.
You're looking for relief, and sometimes that leads you down a road that you maybe didn't expect.
Yeah, so that's what we're diving into today. Analgesic nephropathy.
Big word.
Yeah, it is a big word, but basically what it means is damage to the kidneys from using pain medications too much for too long.
And a lot of times these are the kind of pain medications that, you just pick up at the drugstore.
Exactly, over-the-counter stuff.
Right.
So we want to really break this down for everyone listening, especially for older folks and their caregivers.
Right.
And we're using some great information from Medline Plus.
Great research.
Yeah, it's part of the U.S. National Library of Medicine.
Really reliable.
So we're going to talk about, what causes this, what to look out for, and what you can actually do about it.
Yeah, the practical stuff. That's what people need.
So maybe let's just start with the basics, like what's actually going on in the kidneys when this is happening.
So, think of your kidneys like these little filters, right? They're cleaning your blood, getting rid of all the waste.
Yeah.
And so when we talk about analgesic nephropathy, we're talking about damage to those little filters.
Okay.
And the biggest culprit here is using pain relievers for a long time. Analgesics is the word for it.
Analgesics.
And we're talking about over-the-counter stuff like phenacetin or acetaminophen.
Okay.
You might know that as paracetamol.
Oh, yeah.
And then also NSAIDs. That's non-steroidal anti-inflammatory drugs.
Right.
So things like aspirin, ibuprofen, naproxen.
So all really common stuff.
Really common.
Yeah, and what's interesting is that Medline Plus points out that a lot of times this comes from self-medication. Like you have a headache or you have arthritis, which those are things that are more common as we age.
Yeah, absolutely.
And you just reach for what's in your medicine cabinet.
Right, and it gives you relief, so you keep doing it.
Yeah, so it's like this, it's helpful, but then it can also be this kind of creeping problem over time.
That's it. You hit the nail on the head.
And they even say that, there's some specific things that put you at higher risk.
Like what?
Like using those pain relievers that have more than one active ingredient.
Oh, okay. Combination drugs.
Yeah. Or taking 6 or more pills every day for 3 years.
Oh, wow.
I know that sounds like a lot.
It does.
But if you think about it, if you have chronic headaches.
Right. Or back pain.
Or just those musculoskeletal things that a lot of older adults deal with.
Yeah, it adds up.
It really does. And Medline Plus also mentions some other things like, emotional or behavioral changes, or if you've had problems with smoking or drinking a lot or overusing tranquilizers. And they say it's not that those things directly cause kidney damage, but they might be connected to, how people end up using medication.
Right. Maybe they're trying to cope with something, or there are other things going on that make them more likely to overuse medication.
Exactly. So it's kind of like a red flag to pay attention.
Okay, so we've talked about what causes this, but what does it actually look like? What are the symptoms?
Yeah, because, it's one thing to know what it is, but it's another thing to know what to watch out for.
And this is where it gets tricky, because Medline Plus says in the early stages, there might not be any symptoms.
Oh, so you might not even know anything's wrong.
Exactly. And that's a really important thing for caregivers to remember. You got to be really observant.
Yeah, because if you're not noticing any changes, you might not think anything's wrong.
Right. But as the kidney damage gets worse, you will start to see signs of kidney disease.
Like what kind of things?
Well, one of the first things you might notice is that you just feel tired all the time or weak.
Okay, just kind of run down.
Yeah, and that makes sense because your kidneys help regulate your energy levels. So if they're not working right, you're going to feel it.
So fatigue, weakness. What else should we be looking for?
Changes in how often you pee or how much you pee, that's a big one.
Okay.
So maybe you have to go more often, or you feel like you suddenly got to go right away.
Okay.
And another thing is blood in the urine. That's always a reason to call your doctor right away.
Yeah, that's definitely not normal.
And some people have pain in their side between their ribs and their hip, or just in their back.
Oh, so like flank pain or back pain.
Exactly.
And I think Medline Plus also mentioned that sometimes you might actually pee less.
Yeah, that's right. Decreased urine output.
Okay.
And this is really important, especially for caregivers.
Okay.
There can be changes in how clearly you think.
Oh, like brain fog.
Yeah, like
Yeah.
you might be sleepier than usual, or you might be confused, or just not as alert as you normally are.
So that can be kind of hard to spot, especially in older adults, right?
Yeah, because you might think it's just part of getting older, but it could be a sign of kidney problems.
Right, and that's why it's so important to be aware of all these different things.
Absolutely.
So what else is there to watch for?
Well, some people get this numb feeling like they can't feel things as well, especially in their legs.
Mm-hmm.
And then there's nausea and vomiting,
Okay.
and you might bruise or bleed more easily than usual.
That's scary.
Yeah, and then swelling edema is the medical term for it.
Right.
That can happen all over the body.
So basically, it sounds like if you're seeing a bunch of these things together, especially if the person's been taking pain meds a lot,
Right.
that's a big red flag.
Definitely time to see a doctor.
Yeah. So what happens then? Like, how is this diagnosed and treated?
So the first thing the doctor's going to do is ask you a bunch of questions about your symptoms and what medications you've been taking, both prescription and over-the-counter.
Okay, so they really want to get a good history.
Yeah, and then they'll do a physical exam. They'll probably check your blood pressure, listen to your heart and lungs, see if you have any swelling, and they might even look at your skin to see if there are any changes.
Oh, interesting.
All those things can give them clues about what's going on.
And I know Medline Plus mentions a lot of tests like blood tests and CT scans and urine tests. But what's really important for the patient to know about treatment? What should they be focusing on?
Well, the main goals are to stop any more damage to your kidneys and to treat any damage that's already there.
Okay, so stop it from getting worse and fix what you can.
Right, and the first thing the doctor's probably going to tell you to do is stop taking all the pain relievers they think are causing the problem.
Okay, so cut those out completely.
Especially the over-the-counter ones, because those are the ones people tend to take without really thinking about it.
Right, so that's something you can do right away.
Exactly. Take control of the situation.
But what if your kidneys are already really damaged?
Well, then the doctor might have you change your diet.
Okay.
They might tell you to drink less fluids.
Okay, so those are things to help your kidneys work better.
Yeah, and in some cases, if it's really bad, you might need dialysis or even a kidney transplant down the road.
Wow.
But the main thing is to stop the damage and get your pain under control.
And one thing that Medline Plus talked about that I thought was really important was counseling.
Oh, yeah, that's huge.
Yeah, because it can help you find other ways to manage your pain without relying on medications.
Right. So instead of just masking the pain, you're actually addressing the root cause.
Yeah, so things like lifestyle changes or physical therapy.
Exactly.
Finding things that work for you long term.
And that don't have all these side effects.
So what's the most important piece of advice you would give to people listening when it comes to preventing this?
It's simple, really. Just follow your doctor's instructions when you're taking any medication.
Okay, that seems obvious, but I guess it's easy to forget.
Yeah, especially with over-the-counter stuff. We think, oh, it's no big deal.
Right.
But it can be a big deal if you're not careful. And Medline Plus says never, ever take more than the recommended dose of any pain reliever without talking to your doctor first.
So when should someone actually call their doctor about this?
Well, if you have any of the symptoms we talked about, especially if you've been taking pain relievers a lot,
Yeah.
or if you see blood in your urine or anything weird in there,
Oh.
or if you're peeing a lot less than usual.
Those are all big warning signs.
Yeah, don't wait, call your doctor.
So basically the take-home message here is that even those everyday pain pills you get at the store,
Right.
they can actually hurt your kidneys if you take them too much for too long.
And this is especially important for older folks who are dealing with chronic pain.
Yeah, so you got to be aware of the signs and follow your doctor's advice.
Absolutely.
So I think a good takeaway for everyone listening is to really think about what pain meds you're using, or if you're helping someone else what they're using.
Right.
And if you're concerned about how much they're taking or how often,
Talk to your doctor.
talk to your doctor.
It's that simple.
Yeah, it's a conversation that could really make a difference.
Absolutely worth it.
So that's it for our deep dive today. Thanks for joining us,
Thanks for having me.
and we'll catch you next time.
See you later. Bye.